Well, for his take on Britain's experiment and the current outbreaks and lockdowns in Australia, let's bring in the ABC's own Dr. Norman Swan, presenter of RN's Health Report and Coronacast. Good morning to you, Norman. There's so much to discuss.
There is, Lisa. Let's
start with the lockdown in Melbourne. When do you think it's realistically going to end?
It's really hard to say. It feels like another week. I mean, some modelers are saying 30 days. I just can't imagine that. They seem to be embracing this quite well, tying down very few loose links. I think the surprises that are going to have occurred from the MCG and AMI may well have occurred. One hopes so. And if that's the case, they'll get down to a really controlled situation in about a week, I'd have thought. But I mean, I'm not a modeler, so I can't tell you for sure. But it's not. I don't think it's Friday, but I think it's possible. Beginning of next week maybe would be the case. Just imagining what's happened in previous times. There's just a few wild cards with this virus. You just don't know. And there's been that. The MCG spread is a worry, as is AMI.
That was the worry, and I think you're right. Any surprises, I'm crossing both fingers on both hands, we'll get from that we've got already, and on that basis we should get a shorter rather than a longer lockdown. Which brings us to rapid testing, increasingly talked about, Norman. Should we be using rapid testing for COVID more than we currently are?
Well, there are a lot of people who think we should be. And just to be clear, what we're talking about with rapid antigen testing is a nose swab, which can give you a test result between 15 and 30 minutes. It costs about $10 to $15 depending on the bulk price. And as a context for this, rivers of gold have flowed to private pathology and indeed some public pathology from the PCR tests, which they get $100 for. And they do it very efficiently. And so private pathology has been rebelling against rapid antigen testing. The College of Pathology has. Yet in other countries, they're testing it and using it. There's been a pilot rollout in Liverpool where they reckon just in the pilot rollout, they've saved 3,200 staff days. And in brief, when you compare rapid antigen testing to PCR, it is less accurate. But when you are infectious, it's just as good as PCR at picking up the infection, and that's its main use. And if you use it repeatedly, like every 2 or 3 days, that irons out the error rate. So when people like frontline, police, teachers, others, healthcare workers, or where you're getting overwhelmed, as they are in Sydney, where you're not getting your result back for 48 or even 72 hours, and you need it back quickly, you get the utility of getting it back in 30 minutes versus a small error rate is worth it. So it's not a replacement for PCR, and if you're positive, you need to have a PCR, partly for genomics, but it is a useful adjunct which can take the load off the system. For example, in the southwestern suburbs, they were, before they shut down construction, asking people to get tests every 3 days and your queues around the corner, rapid antigen testing at the site or at football games. Add it to your ticket, $10 to your ticket. You've got to do your PCR at the outer gate before you come in. If you're negative, you can come in because you're highly unlikely to be infectious.
What about vaccinating kids? Because that's back on the agenda now. You've spoken about it before.
We're not going to get to herd immunity without immunising kids. I mean, the policy in Britain is perplexing. Epidemiologists around the world just cannot understand what Britain is doing. You are going to have to immunise down to 12 years old at a minimum. Pfizer is approved that, it's safe. And we should, when we've got enough vaccine, we in Australia should go down to 12 years old, and we should just, we should be escalating research around the world, as they are, into children, younger children, to see whether or not the vaccines are safe in them, which is highly likely to be. But really, as we immunise more successfully in the upper age groups, we've spoken of this before, it will become a childhood disease. Not necessarily a serious childhood disease, but serious enough to require immunisation. That's a 2022 thing, but we are going to have to get down to younger children. But down to 12 years old, that should be part of our policy ASAP.
Okay, now let's finish up with what's unfolding in the UK. What do you reckon about Freedom Day and what it could mean for the British health system, society generally there, Norman?
Apart from the Chief Medical Officer in the UK, pretty hard push to find any epidemiologist or public health person in the UK who thinks it's a good idea. You're going to get a surge in infections. You've got 50% of the population not fully immunised. And they talk about higher rates than that, but that's not including 12-year-olds down to children, the whole population. And a lot of people are going to get infected and a lot of people are going to die. Not as many as would have otherwise because of vaccination, but they seem to be deliberately opening up to allow infection to occur. and children are going to become infected. It seems to be a reprise of what they tried to do in March last year and say we're going to let it rip and get to herd immunity through natural infection. It beggars belief.
Dr. Norman Swan, we've got to leave it there, but thank you as always.
My pleasure.
Thanks, Norm.